Yeah, okay, the Gentry Podcast. I know that you will be loving it. We here to break it down so that you start to understand your local government. Who are the leaders? Time to get active, do something about it. Dealing with jobs, the workforce, and affordable housing. Motivate and inspire. Elevate, take it higher. For the next generation, knowledge is power for your community. Giving you the info that you really need. Time to make a change and a difference. Tune in, don't miss it. It's the Gentry. The Gentry Podcast. The Gentry Podcast. Making a change, switching it up.
Hello, and welcome to the Gentry Podcast. I am Jonathan Mason, your host, and today we have an incredible guest. We have Representative Carla D. Cunningham of North Carolina's 106th District. Carla has served for many, many terms, but she's more than that. She is a person of the community. She's an activist. She is a mother, grandmother, and I believe great-grandmother too. Am I getting that? Yep. Okay. Just wanted to make sure. She's a long-term nurse. So serving and helping is in her DNA. Representative Carla Cunningham, thank you for being here. I appreciate it. How are you doing today?
Today is just another day trying to get some rest in, but otherwise I'm hanging in.
Well, I appreciate you. I know you are trying to take a break from work. I appreciate you coming in and giving us your time. It is very much appreciated. And as I do with everybody, I like to start with the deep question. What is the special sauce of North Carolina and Mecklenburg County? Why is it the best place to live? And I'm a North Carolinian right now, so this one's gonna hit close to home for me. So what is that?
So it's the people. Of course, it's the people. It's the landscape from the mountains to the coast. And we kind of sit in the middle of it, right next to South Carolina, of course. But it's the people that make North Carolina what it is. And it's the beauty and where you can go and have the experiences of what nature has to offer, the natural resources. It's a beautiful, beautiful state. We are attracting people from all over the country that come here. Mecklenburg County or Charlotte is really a hub. We have all the professional football, basketball. Now we have soccer. So we're growing rapidly here. It's probably over 100 and something people coming to North Carolina every day.
100 people every day is a lot. I was just talking to a leader in the Nashville area, and they were saying the same thing. 100. It's just something about the South right now. Everybody is flocking, especially to those cities, and I'm appreciative of all the work you do. Like I said, I'm a North Carolinian myself. I'm in the Raleigh area, but still, I can get to the mountains, to the beach, and the people down here are incredible. But speaking of incredible people, please talk about your background. It's so impressive. Over 30 years of nursing, and then now being a representative of a major
Yeah,
state.
who could even imagine? So yeah, I started 1980, right after graduating high school. I went into nursing school in 1981. Went to Central Piedmont Community College, got my LPN, and of course later I went back and got my associates from Gaston, and then I later went back to Winston-Salem State and got my bachelor's. I've worked in every type of nursing you could imagine. The only nursing that I haven't done is psychiatry in that field. Mental health. I have not done that. And I probably didn't want to do that because that's some very, very hard nursing to do. And my experiences are just vast. I've worked in Virginia. And of course, most of the time I worked in Charlotte and across the state of North Carolina in some rural areas as well. Worked through several agencies when I went back to school to get my associates and my bachelor's. But nursing was in my blood. I was inspired at a young age, around 17. I was inspired by another nurse. Her name was Shirley Elder. I had some surgery done, and she really inspired me to go forward, to go into the nursing field. So that's what I did. But in 2009, when I was exiting Winston-Salem State working on my bachelor's research, I did healthcare in America. And of course, I had heard Barack Obama speak in 2008 at the Democratic National Convention and was just overwhelmed and inspired. I mean, just over the top. I'm all in because he said he was going to tackle healthcare. And I knew what healthcare meant to a whole lot of people. And for me to go into politics, it was up close and personal. It was up close because I had had a son diagnosed with IDD, which is intellectual developmental disabilities, as well as a mental health condition. He was diagnosed at 14, correctly diagnosed the first time he was diagnosed as bipolar disorder. We would later go back and he would be re-diagnosed as paranoid schizophrenic and the IDD, which as a young mother, and I was a young mother because I was widowed early in life. I was widowed when I was 25 years old. So I was raising my children alone, as well as trying to continue to educate myself to remove us from being in poverty. Because when I started out nursing, I only made $4.76 an hour, and that was in 1981. Now you're making 35 to $40 an hour and upward. During COVID, some people made $300 and $400 an hour. But that was my way out, was to continue to become more educated in my field so I could excel and keep my children stabilized. So when Barack decided he was going to do that, I was all in because when my son was hospitalized the first time I was in school, if they're under 18, they still fall under you as the parent for the finances. So they don't qualify if you're working to get Medicaid because it's based off of what your income is. And I was working because I needed my income. But even when I did get my first job as a registered nurse and had insurance coverage, it only covered 50% of his care when he was hospitalized. And we would be hospitalized, and I say we because I'm the we. It's not him just being hospitalized, it's the whole family being hospitalized and on a program to be treated, that I became almost financially in debt because the bills was coming, even though the insurance covered 50%. You could imagine what was left if somebody has to go to the hospital and stay 6 weeks at a time. So, and that sometimes is what it entails to properly treat people that have a mental health or behavioral health disorder. It's not you go in and get a surgery and you get it fixed and you get to go home. It doesn't work quite like that. It's a lot of therapy. It's a lot of assessing and observation that's done to make sure that when they do exit, that they're safe in the environment that they're going in, that those people are going to be safe as well. So that was one of the main reasons I decided to go ahead and help push the ACA, which was the Affordable Care Act. But we knew that the Affordable Care Act had another part to it, and that was Medicaid expansion. That we wanted single payer. Now, don't get you wrong about this. We wanted single payer, but there had to be some negotiating done at the federal level for the president to get it through. And so that was how we ended up with the Affordable Care Act. The Medicaid expansion was left as an option to the state. It wasn't a mandate. It wasn't legislated by Congress that the states have to do Medicaid expansion. They were given an option. So the Medicaid expansion is what I went to Raleigh for after numerous acts. Would you go and keep pushing for Medicaid expansion? And that was my intent, and I did. So I never left what my initial was focus on healthcare and to make sure that people that were in those vulnerable places, like I was at one time in my life, would have accessibility to healthcare, not just physical healthcare, but the mental and the behavioral healthcare as well.
Wow. And my viewers will hear me say it all the time. When somebody is called to lead, it feels so different. It's not that you had to grow up always thinking you wanted to be a representative. It was you had a calling and you were inspired by somebody else, Barack Obama, coming in and championing something that was on your heart already. And the fact that you are them pushing for people, not only for the good of them, which it truly is, but because you actually were in that position that they're potentially still in. I think that is beautiful. And I don't mean to say that because I know it was probably some very difficult times. And thank you for sharing about your son. And also thank you for sharing holistically. Like you said, we were hospitalized. I think that's so powerful for people to hear. It's not just the person who is going through it themselves, but it's the family unit that is going through that. And then because there's a ton of ton of things that I want to double click on, but can you explain the Medicare Medicaid expansion, what it actually is in its simplest terms, if possible?
So, and I'm gonna try to keep it real simple. So Medicaid, we already have Medicaid. We have CHIPS, which is the Children's Health Insurance Plan. That's all children under the 18. They are insured if they fall within their income level. They get insured. But the additional Medicaid expansion, what it did, it would pick up people that did not make enough money to go into the Affordable Care Act exchange that was set up. They don't make enough. Even if they got the stipend that you can get, the incentive to go in, they still didn't have enough money to do it. Now, the other part of that, these people also made too much money to qualify for Medicaid based on the federal poverty rates that are set. That's how we initiate the Medicaid. And it's a two-prong. The state put in and the federal put in. The Medicaid expansion, we got an incentive to go ahead and go into the Medicaid expansion during the Biden administration because of COVID. So when we decided to take it, it was $1.6 billion that we were able to draw down from the federal government. It was our federal money, been sitting there all the time, and our federal money going to other states that did expand. But by us doing it, then it picked up 670,000 people across the state of North Carolina. And guess what? 80% of these people work. 80% of these people work every day. So that is the group of individuals that we were trying to get covered on the Medicaid expansion. The other thing about it, and a lot of people don't realize this, that Medicaid in North Carolina cover more things, more conditions than a whole lot of other states cover. So we cover seniors that are in long-term care facilities that don't have the money to live in those places. That's estimated to be probably $8,000, and that's a month. And that's a semi-private bed. That's not a private room. We're not going to pay for that, but we do pay for that as well. A lot of people don't know that we cover senior citizens that live in long-term care facilities. We cover the individuals that have intellectual developmental disabilities or other disabilities. If you qualify up under Social Security as a disability and an adult, you most likely have Medicaid too. So it works hand in hand with another one. It doesn't work separately. So we put in and the federal put in. But the way we did it in North Carolina is the state doesn't put anything. We have the healthcare providers who receive money through the federal. They are putting the money in for our 10%. The state put 10%, the federal put 90% in. So they put in the 10%, and that comes from an assessment that's done by the federal government on the Medicaid, and then they come back and they put in the 10%, so the state was not required to do any funding in it.
That's incredible, and it seems like you were able to with I'm sure you had a ton of help, but to reach a population of people that were overlooked. And when you think of people that probably need it, it's not people may not think it's hardworking people that truly need that support. 50% of inpatient care, that's a lot of money for anybody. Like that is not a little even if you have insurance, that's just not a little bit of money. But no, that is very powerful from
Well,
your
North Carolina is one of the third highest in the whole country for medical costs. The whole United States, as an industrialized country, medical costs should not be that high compared to the other countries. But we're third in the whole country for having the highest medical costs to us, even if you have insurance, your premiums. So, and it's a whole lot more to that.
that is it's tough, but it makes the fight that you do and continue to do. I know there's some things coming down the pipeline that are gonna, may infringe on some of the work that you've done. But before we get too far into it, and I think I told you before, half of our listeners and viewers are working in local and state government in some capacity, but the other half are young students that are thinking about a life of public service or supplementing where they can. What is a state representative, and what do you do? If you can break it down in the most simplest terms that you can, please.
Tell you, when I first got there, I was like a nightmare. First, you got to find your way around the building, which is very chaotic. The second thing is to figure out how things operate in that space because it's really different. As a nurse, I'm very structured. This is not structured at all. It's all over the place. You need to be a reader. You need to do your research, and nobody's gonna tell you to do it. You're really your own boss once you get there. You elected by the voters, and you your own boss when you get there to do what they want you to do. But you still have to be self-motivated because you really need to read and do your homework, do your research. Don't listen to all the noise because it's a lot of noise. It's a lot of distraction. But if you do your reading and do your research and check out your sources so that you're getting accurate information to make the best decision, you're not going to always make the right decision, but you want to try to get to the best decision. So we make laws and we do policy, but in the House where I am, we don't do as much policy as the Senate does. What happens is I go and I have something drafted, like I had a piece of legislation drafted on CBD 8, Delta 8, and Delta 9. It left the House in 2 pages. It crossed over to the Senate. It came back in 19 pages because they did the policy part of the bill, which I don't totally agree with. But I still want my piece of legislation to move. It probably won't move in the form that it's in now, but it'll be workable to still get some of what I want. So each chamber gets to work on the same piece of legislation. Each chamber may do some amendments to it, and you may get something in it that you definitely don't want. But you have to figure out what is the value of what it is you want compared to what it is that they put in there that you don't want. And most of the time, when I'm looking at a piece of legislation, I'm going to say, how does it benefit the constituents to get us to a place on this particular item? And sometimes it's a very difficult decision to make because it's not a win-lose to me. I'm very optimistic. Like I can take some stuff that I don't want if I'm going to get some of the stuff I do want or that I think will be beneficial to my constituents. So you have a long session, you have a short session. Right now, we in the long session. We supposed to be out, and we should be out in July because the budget was done. The budget is supposed to be done by the end of June. Well, we don't have a budget because the budget is not done. Therefore, we'll continue to go back every month, and we're doing mini budgets right now. And those mini budgets are kind of sacrifice right now for the real budget. So the real budget's still sitting out there, and two chambers are going back and forth what they don't like in it, what they want in it, and they'll do that for a while until they come to an agreement of everybody that's on the committee to say, okay, this is acceptable, and then it'll come back and we'll vote on it and see if it comes, get an up or down vote. But remember now, even though we don't have a budget, it's biennial, so we have a 2-year cycle. So even though we don't have a budget, we have a continuation because we have that overlap where the budget can continue until we finalize the budget.
Wow, that even in the simplest terms, it is confusing.
It
Yeah,
is.
one thing I would double click. You said so you start with a piece of legislation, then it goes to the Senate, and then you said they then add like the public policy aspect of it. Can you kind of speak to what the difference is there? And then how do you said there comes back things that you may not agree. So how does that process go to that piece of legislation actually passing?
So once I drafted, and then it's heard in the House committee. So my bill was heard in health, it was heard in education. It went through one other committee. So after it go through all those committees and we voted out on the House, then it crossed over to the Senate chamber. Then the Senate chamber is going to send it through their committees, and then they're going to be able to amend it as well in their committees. Then they're going to bring it back to their chamber, and they're going to pass it out. And then it'll get to come back over to us. And if it's a concurrence vote, if we say, oh, they'll come back and say, well, we concur. And that means, will you agree to what they've done? And sometimes it's a no. And if it's a no, then it has to go back to the conferee committee, which is a group of individuals picked by the Senate leadership, picked by the House leadership. And they get to discuss about that one piece of legislation, whether they want to move it or whether they want to just let it stay or what they want to do with it. That's how it works. And I'm on that committee this time, but you still got to determine what you want to use your capital on that you have, what is really your top priority. You want to know that because you may not want to use all your capital on something that is not going to impact significantly in your constituency community.
That makes sense. And it seems like you're balancing a lot. It seems like you're trying to make sure that you give some where you need to, but you're still holding to the things that are important to your constituents. But even still, it's like I don't want to use all my social political capital on something that is not. It may be important, but it may not be the most important thing to my constituents. So it seems like you're balancing a lot. And over the many terms that you've been there, what have been some of the lessons that you've learned, or how has your role evolved over time?
So when I got there, nurses, like I said, are very structured. So I already was able to manage myself. And you need a good team. And I have probably one of the best legislative assistants, and I have a legislative research assistant, and I have a legislative assistant. And both of them can make you or break your office. And I have some of the best, I really do, because one of them have been there for years. So she has that historical knowledge of how this place operates, right? So she's able to help me a lot how to navigate and how to get things done. So they're very beneficial. The next thing is I kept my head down and I listened and I did my homework. And that helped me more than anything because when you're a new legislator coming in, you got to set your value. You got to determine where you want to be. You need to know who you are. You need to know your constituency. And I'm not saying leave your culture, leave your philosophy, leave where you come from, your background. That still comes with you. And your own biases still come with you. So you have to be in a position where you're doing more listening and doing a lot of the research. I did that. That was how I earned the respect of my colleagues. It's because I didn't play a lot. A lot of people want to go out and they want to eat and they want to go to this reception and be with the group. Well, that's not going to really help you that much. What I realized is building relationships and not just with the people on the same side of the aisle you on. You got to build those relationships across the aisle. You got to show up to those committees, even though you may be in the minority. They take enroll. Every time your committee assignment come up, they check in the box whether you show up or not. I showed up. I went all across the state and sometimes was the only Democrat that showed up. But I was there and they checked my box. And so I had to keep getting my box checked in order to get additional appointments. And I have more appointments probably than most of my colleagues have. And sometimes it's too many, but you don't want to say no because sometimes it can benefit you later. It may not even be in the subject matter that you want to focus on, but it can benefit you later because Safer Schools was one of the ones that I went across the state with, and I would be the only Democrat show up, and I had a better understanding of why in the rural areas they wanted to do it this way and not the way we do it in the urban area. So understanding that it's a different demographics, it's a different place, it helped me understand where my other colleagues across the aisle, where they were coming from. So, we have different perspectives. So I think that relationship building, and I always tell people, don't keep talking to the same people because you're not going to learn a whole lot new if you keep talking to the same people. You need to talk to different people and you need to hear their perspective of what their perception is. We bring our own perception, but we have to leave a space open to allow ourselves to step in the shoes of the other people that have a different perception from us.
Wow, that's some serious lessons. And it seems like you came in, obviously had some help with like great legislative aides with some institutional knowledge, but you came in with that hunger, that desire to go across the state, to make sure you were taking all the appointments, even if, like you said, they weren't even in your desired lane, but you knew that long term it would help you. And I think that's so smart. And it seems that you do appreciate bipartisanship. And I think it is very important, especially in this day and age, to make sure that you do have allies who may not think the exact same as you, but they may be able, like what are they, like iron sharpens iron. You learn from them, they learn from you, and then who knows, when you're trying to get something that is important to your constituents across the goal line, you may have an ally in a surprising place. So I think that's very important.
Yeah, so that brings me to the year before last. I actually got an invitation to go down to Florida and go with a couple of Republicans to a convention on opioids. So now I'm doing the opioids fellows program through the NCSLs, which is the National Conference of State Legislators, because I was recommended. But I was also able to be a primary sponsor. When we drew down that $1.6 billion, we was able to invest $835 million into mental health, IDD, and substance use services. And I was a part of being able to tell the Department of Health and Human Services, this is what I want you all to put in place. And it happened. And that was from building those relationships.
That's why you do it. That's why you sometimes you say you're the only person showing up, but to be able to send that much money into what you care about and why you do what you do. What was the genesis of why you do what you do is so important. On that note, can you talk about some of the main priorities of the 106th district? What are like the main things that your constituents typically want or typically need? Excuse me.
So I have in my district, and my district is very diverse. I run all the way up to Huntersville out of Mecklenburg County to the north out to University City. UNCC is not in my district. It used to be. So I don't have a university or college in my district now. But what I do have is I have that diversity of independents, Democrats, and Republicans. But inside of my district, I have numerous African Americans that have this program called Village Heartbeat. It runs through 40 different churches in Mecklenburg County, and they focus on youth mental health. They focus on after school programs. They focus on feeding the poor, and they do a lot of initiatives with behavior health as well as with seniors. So that's in my district. They're right in my district. I have IDD children that use after school services at one of the churches down the street, and that's in my district. I have the YMCA in my district. So I have a lot of different people in my district. My district is not poor. It's very diverse. I have some high income people that live out in Howland Creek. I have people in Huntersville, some of them are high end as well. But what I look at as far as what I can do to improve what is in my district, I look at the 501c through my district and what kind of supports they're able to put back into the community where my constituents are. And that's basically, I don't determine their values. I allow them, whoever is in my district, a leadership, if it's a pastor, if it's a woman running a program, if it's a lady doing transitioning housing as a 501c3 YMCA, whoever it is, they're able to reach out to me and express what their needs are in the community. And that's how I pick up and decide on which 501c to fight for to bring resources back home to. And so everybody's not able to bring resources back. You have to learn how to navigate that space to bring resources back because last cycle was the first time I was able to bring resources back because I had gotten into a space where navigating and negotiating, you have to get in that space of getting to a yes. I say it's easy to always say no. It's, it's so easy to always say no. The hardest part about politics and public service is getting to the yes. And that's where the hardest work is done. And so I've been able to navigate that and get to a yes so that I can bring resources home. And it's important in the time that we're in right now because with some of the federal legislation that's coming about, it's going to wipe out a lot of grants that some of those 501c3s were able to get, especially along the lines of DEI. That's going away. So now what do you do to keep those services in place? So I'm planning to fill that gap by making sure I bring resources home until that time runs out. Remember, it's not forever. The president has a certain amount of time and then it's over and then you get a new president. Yes, it's going to happen. It's not going to happen as fast as people may think it's going to happen, but there's still opportunity in that space to reverse it. And we have to stay ahead of the game while we're trying to figure out how to stop or to reverse or to amend and change what has happened so that it doesn't hurt us so bad.
Wow. Two things that are like stood out to me is the interplay between the state and the 501c3s. I don't necessarily know if everyone always thinks about how tied together they are. And it sounds like you very much utilize the connectivity between the 501c3s and the state. And I love how you utilize them to figure out are the leaders in the community that could use the resources and effectively give those to the community. And then the second part would be how you're thinking forward if things are being rolled back at the federal level. And I've talked to a couple people about this, and they're unsure of what it's going to and how it's going to affect, how it's going to trickle down state and local. But in preparation for that, you are gaining the resources and then giving them to your communities. If this is an election that the tides change about the view on certain things, you'll be ready and prepared for that. Now, there's one other thing that I wanted to bring up. You said somebody was at first in your district and then wasn't in your district. And that's something that has been coming up in the news lately. And I'm going to ask you to say it in its lowest terms, a word that keeps coming up. One congresswoman has really been pounding the pavement on this, but gerrymandering and how the districts and certain districts are created. And when I was actually talking to my wife about it, like when I hear it, it kind of sounds like a bad word. Like I can't tell if it's like supposed to be done, is it allowed to be done, or is it just done? Like, please explain it to me for the
So,
viewers and for me, honestly.
yeah, it's a little complex. So, what happens every 10 years, the census is done. And that's how it works in North Carolina. The party in the majority, the party in charge, gets to draw the state lines for the representatives and the senators. And they also get to draw the congressional lines. So the gerrymandering I've gone to the hearings and it's real complex. It's like you packing people, you packing a certain group together so that that particular group of constituents, their votes are going to come out a certain way, right? So you can pack all the Dems over here. You know you're going to get a Dem rep out of there, or you get a Dem Senate out there. So what they do is they draw the lines, each party in charge draw the lines to benefit how many senators are elected Republican, House representatives are elected Republican, and that's all done through the lines. Now, it's always been done like that. When the Democrats was in charge, they did it too. But this time, for 30 years, the Democrats had control in Raleigh for 30. So they had plenty of time to figure out what to do when they did get in charge. So they apparently had a plan, and they've worked this plan to keep staying in charge. But you still can change it. But it's up to the voters in the voter turnout to change it. Because if you only got a low percentage that's voting, it's not going to change. You got to have a real turnout in those gerrymandered districts to flip it. So it's done by the numbers. They look at all of that and they do it. And that's what happens now. A couple of years ago, we tried to ask for a master drafter. Some places, some states have a master drafter of the lines, but we don't have a master draft. The master drafter would be independent. They wouldn't draw based on party affiliation. They would just draw based on population and the demographics.
See, that's so interesting. So, because that's why sometimes you can't just watch the news, because when it's being said, sometimes it's like this one party's doing it, it's bad, you're not allowed to do it. But it sounds like from your perspective, everybody's kind of doing it, and it just ebbs and flows who's doing it and when.
And it's picking your voters. That's exactly what it's doing. It's picking your voters instead of your voters picking you. But your voters still are picking you, especially if you have a primary. If they elect you, then you come through the primary and you get to the general. Your voters are still picking you. It's just different the way that the lines are drawn, looking at the population and who they are, their identity, and they're able to see all of that. So I think what's important for us right now is to know that in 2026, next year, if we can change the House congressional and get Democratic seats there, we can actually put a block in place for some of the legislation that's already been done. They can actually do some negotiating for some of the bad stuff and get it amended if we could get those seats in the congressional space. And it'll take more than just North Carolina. We're not drawn to have that many seats. It'll take all over the country that they would need to pick congressional Democrats to hold the House, to take control of the House. They probably won't be able to get control of the Senate, but they can hold up because it'll have to be a balance, and they won't be able to balance without negotiating. Yeah, but if we not in play by 2028 in North Carolina as far as the House and the Senate, the census is done in 2030. You have to be in place by 2028. So that way, once the lands have the opportunity to be drawn, if you in place in 2028 before the census is dropped, you get to draw the lines. That's how it changes. That's the power shift that takes place. But your voters got to understand this is not time to stay home. 6, we need Congress. And in 2028, we need to make sure that the Democrats in North Carolina, House and Senate are in play before 2030 when the census is completed.
Yeah, this is powerful stuff, and I definitely hope our viewers are listening. Just how much strategy goes into this, and how much preparation ahead of time has to be done, and then with the low voter turnout, it doesn't matter how much strategy you put in place if the people don't come out.
Well,
And
we need a plan, and it needs to be a long-term plan. I think we haven't had a real long-term plan, and they've always had one. They've always had ALEC, which is a conservative think tank, and they've had plans in place for years, and we don't seem to have a long-term plan in place. And if we did, I would suspect we wouldn't be in a position that we're in right now, where we're not able to take back the majority or be in a position to even balance it out. Because right now we're very unbalanced in North Carolina.
that is very powerful. That long-term planning and then thinking about the future. Well, I think that's a good place for me. Are there any initiatives that or piece of legislation that you have that are coming up, or things that you want to see or that you've already enacted that are coming out and going to be worked on in the
So I have a supervision piece of legislation. What it would do South Carolina already does it. It would take and put the 988 number as well as the crisis line and the North Carolina peer support line on the back of all student IDs up through college. And they would have it with them all the time if they got their student ID. That made it inside of the budget. Once the budget passes, it will become law. The other initiative that I'm working on was the Delta 8 and the Delta 9 help to relative span. I know I'm going to get part of it. I don't want it on school grounds. I don't want it in any school activities because we don't really know what's in Delta 8. It's not FDA approved. Not that FDA is right on everything that they approve, but we literally don't know what's in the synthetic. With the vaping, what we found is there's a new disease out called popcorn lung, and it's similar to COPD. And we're finding it in the children that are vaping now, and the damage is irreversible. Irreversible. So that was very important to me because we don't know the long-term effects of what is going to be the health outcomes later on. So that's huge. And I think I'm going to get some of it, but I'm not sure about all of it. One of the other things that I did that I'm proud that I did was able to get 2 additional jail inspectors in the state of North Carolina. We only had 3 for 100 jails across the state. And the reason I wanted them was because we had the people committing or overdosing in the jails. Most of these individuals under the age of 35, most of them were male, and most of them had not even been to trial. And so I was able to get those 2 inspectors in the last cycle. I was able to get school lunch debt wiped out across the entire state. Mecklenburg, Anson County, and Union County was the top 3 counties across the state that ran school lunch debt, where the children were struggling to eat. And the school would run a debt. And sometimes they were shamed because they didn't have the money. So I was able to get the $6 million in the budget and $3 million recurrent in the budget every cycle to wipe out school lunch debt across the entire state. So that was very important for me. I'm doing so much sometimes I can't keep up. Let's see, what else am I doing? I'm working on the affordable housing is another issue. We've done a piece of legislation that's standing right now. A lot of cities and counties got some issues with it, but I think we're over-regulating where places can be built, how close they can be built, what can you put on your property. So that's a huge issue. We were looking at the what you call them additional dwelling units, being able to put an additional dwelling unit on your house because we're having such affordable housing issues, and they're huge in Mecklenburg County. They're huge all over the state, but especially in the urban areas, people are priced out. And so I'm on a piece of legislation to look at that, and I'm struggling with some of the counties and cities about it. But they're not going to be able to do it all by themselves. The state is going to have to play a role in some of the deregulation, especially on the development, because the coding and people come out and inspect and keep coming back and forth, and it's costing more money every time the inspector come out. That's a development issue, but it's also slowing us down from moving into getting some additional affordable housing in here. So that's huge for me. And the squatters bill is huge for me. We don't have a squatters law in North Carolina where people can move into your house and take over if you're absent, and then you have a hard time getting them out. So that's another initiative that I'm working on this time.
You are definitely doing a lot. I see how it speaks on your purpose, your calling, and then your legacy. And my final question is just that. In 20 years from now, what are they going to be saying about North Carolina or Mecklenburg County? And what are they going to be saying about Representative Cunningham?
I don't have a clue. Probably gonna say she was they're probably gonna say she was a hard worker, but they're gonna say, but man, but when she let you know what her value was, she let you know because I got this saying. So I got this saying, and it is so important for us as women, as African Americans, and I'm gonna say Black Americans because I'm ADOS. I am truly an ADOS, and that you know we have to teach people how to treat us. That lets people know where your value is. And so I got this saying some days when I'm very focused on where I'm at. And I don't like to stay in a negative space. I can't stay there. I got to find a way to get over here to the positive space. I'm not gonna stay there long. I got to move, I got to go. But what I say is if you approach me and it ain't good, I'm tell you not today. And so you have to set boundaries for yourself so that you can stay sane in this environment because it's very tough. And I don't care who it is, if it's a Republican, a Democrat, Independent, if it's not what you can handle that day, tell them not today. They might can come back tomorrow and approach you, but just not today because everything is not going to happen overnight. It takes time for change, and people don't like change. Change is difficult, but you got to keep yourself together. You got to take care of yourself. Align yourself with who you are. Take care of yourself health wise. Spend as much time as you can with your family. And most of all, let them and then let you.
I love that. And that is a beautiful message to end off with the viewers. You have to pour into yourself. You have to pour into your family. You gotta let some people be them. And then you gotta let you be you by asserting your value and letting people know how to treat you. Representative, I am so thankful that you gave us the time of day. I know you're supposed to be taking some off time, and I do apologize for that. But I know my viewers got a lot out of this, like I did, even learning how to strategize and how the bigger game is actually being played. So I'd like to thank you on behalf of the viewers. And as always, this is the Gentry Podcast. I am your host, Jonathan Mason, and we have North Carolina Representative Carla D. Cunningham of the 106th District. And we just want to say thank you again. I appreciate you being here.
Thank you.
Have a great one, everyone.